Hi, I'm Dr. Bob Summer from Columbia University. If you've been recently diagnosed with a heart rhythm problem called atrial fibrillation, or AFib, or even if you've had AFib for a long time, I want to talk to you about a new medical trial that might be of interest to you. It's called the Champion Atrial Fibrillation Clinical Trial. The purpose of the trial is to compare the typical blood thinners which we use to prevent stroke in patients with atrial fibrillation with a one-time heart procedure which could eliminate the need for blood thinners altogether. First, let me give you a little background which will make it easier to understand why we're doing this trial. There are four chambers in the heart. If we're looking at our patient from the front, that would make this the right side of the heart and this the left side. The two top chambers are called the atria. There's a right atrium and a left atrium. The two bottom chambers are the right and left ventricles, which are the main pumps of the heart. The atria collect blood coming back from the body and from the lungs. The ventricles then push that blood out to the lungs from the right side, while the left side pushes the blood all over the body to supply the organs and the brain with the oxygen and the nutrients they need to do their jobs. When a patient has a normal heart rhythm, an electrical signal starts at the top of the right atrium. With each heartbeat, that signal passes throughout the entire top of the heart very rapidly, telling all of the muscle cells in the atria to squeeze at the same time. When this happens, the top chambers of the heart contract uniformly like a pump, pushing the blood down to fill the ventricles, which then pump the blood out to the body and the lungs. So in a normal rhythm, with each heartbeat, the top squeezes and then the bottom squeezes. It's a very efficient system. In contrast, when a patient has AFib, the electrical signal in the top of the heart is disorganized. Instead of squeezing in a coordinated way, the top chambers quiver. This can result in a number of problems, but primarily when the top of the heart isn't squeezing normally, it doesn't empty well. So the blood in the atria sits around and blood clots can form. If this happens in the left atrium, the clot can potentially travel to the brain, causing a stroke. Most of the left atrium is covered with very smooth skin like the gums in your mouth. It is an unlikely place for a clot to form. But one part of the left atrium is different. It's called the left atrial appendage, and it's a small sac attached to the left atrium. Everybody has one. The reason why the appendage is special is that the inside of the appendage is not smooth. There are all kinds of little muscular ridges. In fact, it looks a lot like the inside of an English muffin. The nooks and crannies in the appendage make it a great place for a clot to form, and we know that in patients with atrial fibrillation who have had a stroke, 91% of the blood clots that were identified were found in the appendage. That's why patients with atrial fibrillation are typically started on blood thinners like Eliquis, Xarelto, or Pradaxa to reduce the risk of making clots and thereby reducing the risk of stroke. We used to use a similar medicine called Coumadin or warfarin, but most patients starting blood thinners today don't take that anymore because the newer medicines are more effective and easier to use. But unfortunately, not everyone can take these medicines safely. While they can cause uncomfortable symptoms like abdominal pain or hair loss, more worrisome is that they can cause severe and unexpected bleeding in the joints, in the intestines, and most frightening, in the brain. So what can we do for these patients? We can stop the blood thinner so they don't bleed again, but that leaves them at risk of stroke related to a blood clot. Or we could leave them on the blood thinner so they don't have a stroke, but then they have the risk of bleeding. Not a very satisfying choice for either the doctor or the patient. Then about 15 years ago came a solution for these difficult patients called the Watchman device. This small device, which looks like a jellyfish or a parachute, was designed to be implanted into the heart through a small tube introduced through the vein in the leg and act as a plug to close off the left atrial appendage so that blood could no longer flow in or out of the appendage. If no blood were going in, no clots could form there, reducing the risk of stroke. The trials of the Watchman device were very successful. After 5 years, the patients who got the Watchman device and stopped their blood thinners had fewer strokes, had far fewer bleeding complications, and lived longer than the patients who stayed on the blood thinners. Thus, the Watchman device was approved by the FDA in 2015 for patients with atrial fibrillation who have a high stroke risk but who had a reason not to take the blood thinner medicine. Since the approval, the procedure has become very routine for patients who can't take the blood thinners. Since 2015, over 100,000 Watchman implants have been done with a remarkable safety record in this population. That finally brings us back to the Champion trial. The simple question that the trial is trying to answer is the Watchman device as good as the blood thinner medicines for the patients who can take the blood thinners? To become a participant in the trial, a patient would have to have been diagnosed with atrial fibrillation and be eligible to take a blood thinner medicine. After entering the trial, patients will be randomly picked to be in one of two study groups. The first group will get one of the current blood thinners like Eliquis or Xarelto or Pradaxa. The other group will get the Watchman FLX device, a newer, safer version of the Watchman device, which has replaced the older version and has been FDA approved since early 2020. Neither the patients nor their doctors will choose what therapy they get. It will be assigned at random by a computer. The two groups will then be followed for 5 years. After that time, the groups will be compared for success in preventing stroke and for other complications related to the therapy, either due to the Watchman FLX device or to bleeding from the medication, depending on which group they were assigned to. So if you're just starting or are already taking blood thinners for atrial fibrillation but really don't want to be on it for life, you could consider participation in the Champion trial. Of course, there's no guarantee that you will get the Watchman device, but because you are able to take the standard blood thinners, under current guidelines, you would not be eligible to get the Watchman procedure. I hope that was helpful in understanding the Champion trial. If you need more information about the trial, you can log on to the National Study website, www.watchman.com/champion-AF. If you live in the New York metropolitan area, you can email our research team at championtrial@cumc.columbia.edu, and one of us will get back to you. Thanks for watching.